All right, so you said earlier that you could make a pretty good argument that health care might be dead if the Republicans win this one tonight. Could you make that argument in some sort of précis?
Well, look, I don't quite understand how we tie ourselves in knots trying to desperately to get a 60th vote, and then we wake up perhaps with only 59 votes, and it gets any easier. I just don't think that if you believe what a lot of folks in the Senate believe, which is we're not a country that believes a majority rule, you've got to have 60 votes to do anything. If we wake up tomorrow and there's only 59 Democratic votes, I don't see how we get this done. Now, I think we've made some crucial mistakes along the way by making this more complicated than it needs to be. We've abandoned some of the principles like expanding Medicare, maybe paying for it with TARP money, and instead have gone to this plan that, whatever the results are tonight, it's pretty clear that a lot of voters don't like the direction we're going on health care. But if we don't have 60 votes, I keep hearing that senators say without 60 they can't pass anything. Well, it looks like we might not have 60.
So what is the Speaker talking about? Do you know when she said that it's going to happen one way or the other?
Well, I just left a caucus with the Speaker and my colleagues, and they're talking about the negotiations at the White House. It seems to have a flavor of whistling past the graveyard. I mean, I don't think that negotiating around a 60-vote Senate majority really makes a lot of sense if late tonight, however this works out, and I hope that Martha Coakley wins, but if we don't, it dramatically changes the environment. Look, the Republicans have said that if they get this 41st vote, they're going to use it to kill health care. I think we should take them at their word.
So, presuming that 41st vote, what do you do? Do progressive members agree to pass the Senate bill, or if do they hope to fine-tune something and use reconciliation? Do you punt? What do you do?
Well, I think we may need to first take a step back and say we get the message. We know that some way that we're going here is not resonating. When you have 2 out of 3 independent voters in Massachusetts saying one of the reasons that they're trending towards Brown is that they don't like health care, that's a sign we should say, look, we get the message. Now, my view is what you do is you say as part of a jobs bill, you have a much simpler approach to health care. You take something that we know and understand like Medicare and grow it. I've been saying it on your show for months now that simplicity is getting lost here. But I also think that we have to be careful not to compound getting it wrong with a sense of arrogance that we're going to push through no matter what any of the voters say. I think what's coming out of Massachusetts is a lesson that we should hear, and whether Coakley wins or Brown wins, I think it's pretty clear we're not doing a good enough job selling this.
Is Massachusetts unique because of the nature of health care there, that essentially whatever was going to be passed through this the last version of the Senate bill would be a step down for Massachusetts residents, only they'd have to pay more for it? Is that really the contributing factor to this?
Well, perhaps. I mean, they've been through this debate and conversation a lot more than most citizens have. They understand the idea of exchange. They understand how difficult it is to contain costs. But I think it's too simple just to say that. I mean, there are a lot of elements to this. I don't think that our candidate did a terrific job. Hopefully she wins. But I think that we need to start hearing the message here that this idea of whatever comes out of the Senate that gets 60 votes automatically makes it a good bill. I'm not sure I buy that. At a certain point, this debate has to be about something, and the president needs to stand up and say, here's what this is about.